Welcome everybody. So, what we're going to be doing is just working on the deep breathing. We're going to start off with standing up. Whenever you start this exercise, by standing up, your body naturally goes into a um, uh, more neutral position. When you're sitting down, it's very easy to slouch. Later on, when you get used to doing this quite a bit, then you can start transitioning to sitting down and doing this exercise. So when we start, you want to make sure standing up and having your feet flat on the ground, roughly about shoulder width apart. If it's a little bit more than that, that's absolutely fine. We're going to be nice and solid. Have your knees just slightly bent. So if you were to bounce up and down, you can be very grounded and be strong. Okay. So what we want to do is we want to first, right, just check our shoulders. What we want to do is roll them back. And you'll notice when you roll back your shoulders, right, something your body naturally starts to shift. So if you were to lean forward, part of your body starts to adjust. If someone is rolling their shoulders forward, they're having their head down, the breathing is constricted. So by rolling the shoulders basically back, we open up the chest and notice as well with the back, when this happens, there's a little bit more curve in the upper part of the back. By rolling it, suddenly we start noticing that there's this natural curve at the back. Make sure that it's nice and steady. Roll it back, open up the chest, and then if your neck is like this, you're restricting your airflow. So you want to have it more or less neutral, or you can look a little bit up. So we're in about forward, we're a bit up. That's fine with when it comes to head level. So when you're doing that, roll the shoulders back, open up the chest, and what we want to do, the hand gesture is just to represent the breath. What we're doing is when we breathe out from the side and breathe in, notice that the breath goes all the way down. And as it does, it kind of like pushes out the belly. Okay. When the breathing, when you breathe out, notice that the belly goes in. Okay. There's not much action in the chest. If it moves up and down, that's fine. It's not a problem. All we want to be doing is breathing all the way down and filling up our lungs. When anyone has any tension in the body, anxiety, in panic, what's tending to happen is they're pulling all of their air, right, using their neck and these sort of muscles around here, right, because it's and it's very, very fast breathing. Okay, that's why a lot of people who have anxiety or trauma, you'll see that the body shape is usually like this, and there's usually a lot of tension, and their breathing is quite shallow. So by opening up and breathe it all the way down. When we take that conscious decision to breathe all the way down, guess what's happening? We are allowing our body to actually breathe slower because it's tricky to breathe quickly and deeply. It's possible, but it's a little bit more tricky. And so by slowing down our breathing and just focusing on what's inside. And so the reason why we place the hand on the chest, just anywhere roughly around about the chest, and my belly button is about here, right? I'll put the palm just here. As I said, if you move it a little bit, it doesn't need to be exact, right? All you need to do, right, is when you're breathing, is just notice if you're breathing all the way down, there's going to be a natural movement here. And that's all we're aiming for. The reason why we place the hand on our chest is just to notice, right? Are we breathing into our chest or are we breathing down to the bottom of our belly area? So when I breathe nice and deep, notice what happens to both hands. Now you would have noticed with those two deep breaths is that my hand here would have went out quite a bit and the hand on the chest would have moved just slightly. So it's filling up from the bottom first and then upwards. And then when I go to exhale, there's very little movement on the chest, but there's large movement on the belly area. And so we want to be doing that preferably for a few minutes. Now, I know some people, what's going to happen is it can feel quite uncomfortable to breathe and have the attention in the body. That's okay. All you need to do is just practice for as long as you can. If that's 10 seconds, 30 seconds, at least you're starting. If you can do that at least once a day, right, for as long as you can, that's a start. We want to build up to twice a day, three times a day, right? Once in the morning, once in the evening. If you can fit it in the middle of the day, even better. If you're fitting it in for about like 2 minutes, that's basically 6 minutes out of your day to feel a lot more calmer, more grounded, and present. So on the next video, we'll guide through the process. So I look forward to seeing you there.